House MD, in my eyes, is probably one of the most formulaic shows there is. That's not to say it's bad, it just may be one of the only shows to have its exact plot structure on the first paragraph of its Wikipedia page. There, that's it. That's House episode. That's part of every House episode. And what, in my eyes, makes House episode is how the actors and writers utilise and explore the confines of a plot structure such as House's. And Season 1, Episode 21, 3 Stories, uses this formula to create one of the best episodes in the series and even in medical drama history. 3 Stories switches things up straight away. Gone are the dramatic cold opens of the first 20 episodes, and instead we're greeted by Cuddy telling House that he has to lecture a hall full of students. Not only that, but we meet Stacey, House's ex-wife who hasn't seen him in 5 years and also has a dying husband. Keep in mind this is all in the first minute of the show, so we'll come back to her. Now, choosing the setting of a lecture hall rather than the boardroom and the characters of the medical students rather than his usual associates sets up a large opportunity for humour, and House can play off them in his usual House style. But the writer David Shaw uses a much more interesting device to set up and pay off the usual House-isms. We follow 3 stories of 3 characters who all have leg pain. Person A was bitten, Person B was injured playing volleyball, and Person C is Carmen Electra from Baywatch fame. And there's the first twist in these stories. House is telling them he is the unreliable narrator. This allows some incredible creativity by Shaw. Characters such as the medical students can invade his fantasy, clearly having some impact on the decisions he made. But House being the narrator leads us through these stories, creating ample humour through the scenes.
Could be a blood issue. We should run a CBC and a D-dimer.
And get an MRI.
MRI or a PET scan?
If the problem's vascular, he's better off.
Sorry. Thanks for playing. Patient's dead. You killed him.
As the episode progresses, we start to slip back into the usual House format. Chase Foreman and Cameron appear, and we learn more about the 3 patients. Patient C is not, in fact, Carmen Electra. Surprise. But a supposed drug addict who's just faking the leg pain as to get more drugs, as claimed by the doctors and medical students. House's reluctance to also be truthful about the true identity of this character starts to create a bit of a mystery as to who she or he really is. As the episode progresses, we learn more, and we find out that the 3rd patient is indeed House.
It was an aneurysm that clotted, leading to an infarction.
God, you were right. It's House.
We have to do the surgery. The necrotic tissue has to be removed.
The muscle death occurring in his leg means that Cuddy and Stacey, I told you we'd get back to her, have 2 options. Option A is to bypass the leg, and option B is to cut off the leg entirely. Now option A could lead to a bunch of pain and even death for House, and option B means that he loses his leg and possibly even his job. I say 2, but Cuddy proposes the 3rd option. Remove a lot of muscle from the leg, thereby forcing House to walk with a cane. Being House's wife and medical proxy, Stacey chooses that 3rd option. Throughout the episode, we also see other characters interacting with Stacey, such as Wilson, who consoles her for House's usual coldness. However, this reveal contextualizes House's and Stacey's relationship in a deep, more complex situation. She is the person who cost him his life, or at least that's what he thinks. This then puts Stacey in a tough predicament, as she wants House to help his husband, when in his eyes he didn't help her in his time of need. Lloyd's performance in this episode is certainly Emmy-worthy. House isn't a character you would usually feel empathy towards. He is never really put in situations where his personal life is the focus. That's what his associates are for. They are used as the audience surrogate so that we can see House through their eyes. House leading us through this life-altering experience reverses that dynamic. We are exploring and dissecting this behemoth of a character without even realising it, which is a testament to Shaw's writing. This episode simply would not work in the confines of a usual House episode. The subtleties such as Carmen Electra slowly switching to a man who looks more and more like House, or the way it intertwines Stacey so effectively with House's life despite the audience never even seeing her before this episode. Choosing to format such a pivotal episode in a non-linear style allows for Laurie and Shaw to explore the character of House more effectively and more deeply, which result in the ability to pay off the setups and hints to the plot twist that just hit the audience harder. The non-linear style also allows Laurie and Shaw to just have more fun with the character. Apparently the episode and its false flashbacks were inspired by French film Je t'aime, and despite not being able to nail down a hard source for that, it's very understandable to see why people might think that. Scenes where House can break the fourth wall because he can directly interact with the non-linear framing of the episode lead to some of the best scenes of the series. In comparison to a regular House episode with its usual Mr. X, this episode sets itself apart due to the fact there is simply no mystery.
Okay, it's enough about the volleyball player. What's up with the farmer?
What farmer?
Snakebite guy. Oh, right, you guys don't know about him. He doesn't get bitten until 3 months after we treat the volleyball player. Luckily, it's been well established that time is not a fixed construct.
There is no race against clock or a soon-to-explode aneurysm. House is simply just retelling events that have happened. Whether it be the usual scene where the patient or associate say something and House says, "Say that again," and then they figure out the diagnosis, there is just Laurie and Shaw telling a story. A deep, intricate story of characters that we've been following for 20 episodes, and this episode just lets us sit down and step back. It looks at everything, from House's relationships to what it means to be House. The episode ends with House's associates figuring out that Patient C is House, and House telling Stacy that he will help her husband. Not only does it use the past to set up the finale of the series, but it uses non-linear storytelling to create one of the best episodes in the entire show and of medical drama history.